Hi, this is Parminder from Move Physio, Delhi. Okay, so the topic we have picked up for today um, is whether knee osteoarthritis is it a disease of a whole person? Then the answer is yes. It is the disease of a whole person um, because there are many factors which can lead to knee osteoarthritis, and it is not just the knee joint involvement which is there, but there are other factors as well which can influence whether you're going to get knee osteoarthritis or no. So what are these factors? So some of the systemic factors are your age, your gender, obesity, any kind of inactivity, and genetics. Okay, so again, some of the factors which I'm mentioning right now are kind of modifiable. For example, obesity, it's modifiable, and then inactivity. So in my previous videos I have discussed like according to US physical activity guidelines, every person should perform at least 150 to 300 minutes of moderate level of activity every week. So if you avoid inactivity, you can actually avoid the chances of having knee osteoarthritis. All right, then what are the other factors? There are mechanical factors which again can lead to knee osteoarthritis. Again, obesity, your joint loading, joint alignment, and muscle weakness post injury due to aging, or due to any other kind of condition, and then injury. So when these systemic and mechanical factors, they combine together, they can actually lead to the systemic osteoarthritis, or the clinical presentation of um, knee joint osteoarthritis comes up. Okay, and beside these factors, there is also the psychological component which plays a very major role here. So if a person is suffering from any kind of anxiety, depression, um, it can influence the pain perception for the knee joint osteoarthritis. All right, so there are recently I was treating one patient who had a kind of very chronic condition, and she was dealing with that condition for past many years. So what she actually started saying to herself that it's okay to have pain, and because psychologically she has that pain perception is changed for her, so it is altered, and now she doesn't feel like how a normal person feels the pain. So probably when the pain intensity is very very high, then only she complains about the pain, but otherwise kind of moderate level intensity is kind of fine for her. So again, the pain perception is kind of very important here. Okay, all right. So what all areas we can tap into when we talk about knee osteoarthritis? So first one is obesity. So obesity is kind of a risk factor for knee osteoarthritis, and if we if a person reduces the weight, then this risk factor also goes away. But the weight loss, or the intervention which we use for reducing the weight should be individualized, and we cannot generalize it, because adherence to the intervention is kind of differ from person to person. So yeah, we need to see every person individually, and then see what can benefit them and how can we help them in reducing the weight. All right, second is neuromuscular exercises and other proprioceptive training. So when the joint position sense kind of training is given, especially to the sports people, it can actually reduce the chances of having the knee osteoarthritis by 50%. Okay, so it is important for any person who is into sports related activities to perform these exercises regularly, so that his joint and the muscle strength is kind of really good, and the future chances of having the osteoarthritis, um, they get reduced for him. Okay, next is impaired muscle function. So it can happen due to aging, it can happen post injury. So it has been found like within a day, the muscle around the knee starts to show like reduced activity if there is any injury or any kind of like trauma happens around the knee. So it's very important for us to maintain good muscle activity and perform certain kind of exercises or activities regularly, so that we can reduce the joint load, we can protect our joint cartilage. Okay, and again delay any kind of knee osteoarthritis to happen in future. All right, then biomechanical interventions like knee brace or exercises again can help in preventing the knee osteoarthritis, and this applies even if the person gets any kind of injury. Even then the uh, these biomechanical intervention can be provided. Even for people who have some kind of disability or like malalignment in the joints, even they are very prone to have knee osteoarthritis in future. So it's important for us to provide any kind of bracing or any kind of knee support to avoid this. Okay, so uh, generally knee osteoarthritis, it develops over the period of time, so it does not happen in a day. It develops over 10 to 15 years. All right, so we can take measures to prevent it or to delay it. Okay, so if you identify the problem in early stages, you can perform or do some kind of interventions to delay the progression of osteoarthritis. Okay, and for every 1 kgs of extra weight, there is 9 to 13% increased risk of developing knee osteoarthritis. So it's always good to have your BMI in control. If you're overweight or obese, try to bring your BMI down and reduce the risk of having knee osteoarthritis. Okay, now there are 3 different levels of prevention which can be mentioned for knee osteoarthritis. So what is primary prevention? So avoid any kind of injury at first place, because whenever injury happens, there is a high likelihood that you will get knee osteoarthritis in future. So second prevention is diet and exercise. So use both of these to reduce your weight. Okay, and diet is particularly important for weight reduction, because exercises alone cannot help you. But yeah, once you have reduced the weight, then exercises can help you in maintaining a kind of a good weight. Okay, and then muscle activity is also kind of secondary prevention, and the third one is prevent the progress of the disease, so that is tertiary prevention. Okay, now we see radiological changes in knee osteoarthritis, but sometimes they do not correlate with clinical features. So up to 50% of cases who show radiological changes, where then there can be spikes, bone spiking can be seen, they do not experience any pain. And similarly, 50% of the people who experience pain, they do not show any kind of features on their x-rays. So again, like you cannot correlate your clinical symptoms with x-rays directly. Okay, and try to go more with the clinical features rather than just seeing the x-ray and getting worried about the things. And also the psychological component, especially for weight reduction, some kind of motivational interviews can be used again. Even they help people in recognizing how and like what kind of strategy they want to use for their own weight reduction. Okay, so if we need to summarize it, so you need to maintain healthy lifestyle, you need to have or perform regular physical activity, then use prevention strategies, which we talked, like you need to go for dieting, you need to perform your exercises for weight reduction, and then perform the exercises for muscle activation. Okay, so all these things will help you in preventing knee osteoarthritis. But in case you get any kind of injury, or you undergo any kind of surgery, then also you need to perform your exercises, and you can use some kind of biomechanical interventions like the braces, or some other kind of shoe modifications can be provided, which can help you in reducing the chances of getting knee OA. All right, so with this, yeah, again I would like to emphasize, it's not just the changes which happen around the knee, it's the disease of a whole person. So if you can take care of certain other aspect of your whole body, you can actually reduce the chances of having it. So it does not happen in a day. It starts like in the age of 40 or 45. So if you maintain your healthy body weight, if you take care of your body, if you maintain good healthy lifestyle, you can reduce the chances a lot. Yeah, so with this, I would like to end this video. Yeah, I'll meet you soon with some other interesting topic. Bye.